All right, we are live. It's Tuesday night, guys. Hey. It takes a few minutes for people to jump on. So, I get on here and ramble for a minute. I missed you guys last week. I didn't go live last week. I did the pre-recorded, but still the live feeling. So we did the adoption video. So if you haven't had a chance to watch that, you can find it. It lives on my YouTube page, which is ReLive, #QueenOfQuestions. And I have to tell you guys, I was at a at-home party tonight, like a Tupperware party. Only it wasn't a Tupperware party. It was a brawl party. And the girl was giving her presentation, and I was like, oh my gosh, Queen of Questions, because guess who had all the questions? I had all the questions. So it is Tuesday night, 9 p.m. You know what we do. So welcome to ReLive. Tonight we are going to talk about suicide awareness, suicide prevention, and today is day 3 of September. Can you believe it's September already? I can't. And September is Suicide Prevention Awareness Month. So to help us tonight, I have on here Dr. Susan Kersey. She's the director of Purdue School of Nursing Psychiatric Mental Health Nurse Practitioner Program. And she also has a lot of experience. So she's going to talk to us tonight about something that's, very sad, but it's a very real topic that we really need to discuss. So thank you so much for coming on tonight to share with us tonight. I'm super excited to have somebody on here with a great background. She has about 25 years of experience in psychiatric nursing. Mm-hmm. Most of it she has spent as an advanced practice nurse. So she's going to share her wealth of knowledge with us. She's worked with families in some of the community mental health centers. So Dr. Kersey has a lot of knowledge that she's going to talk to us about. And, like I said, we're going to talk about this. We're going to try and not make it so taboo, right? Because it is something we need to talk about. And I feel like if we talk about it, it helps get the word out. And it's Prevention and Awareness Month. So that's what we're going to do. And that's why I chose to have this topic tonight of all nights. So first off, like I normally do, I like to kick off with some statistics. So these statistics might blow you guys away. And I think Dr. Kersey has some to kind of piggyback on what I say. So did you guys know that suicide is the 10th leading cause of death in the U.S., according to the American Foundation for Suicide Prevention? 10, guys, the 10th one. And then this one is alarming. Indiana, our good old Hoosier state, is number 1 for teen suicide ideation. So teens that think about this. So those are some pretty alarming statistics. And I know that you had some others that you wanted to share with us.
Right. Well, I was a little surprised when I was preparing for this to learn that the suicide rate has actually risen.
Oh, wow.
In the last few years. It's up about 30%. Mm-hmm. And Indiana is the same. Indiana's suicide rate has risen by about 30% as well.
Wow. That's incredible.
That's
incredible. One thing I forgot to mention, guys, if you're on here tonight, if you've been affected or if suicide's touched your life somehow, if you want to just raise your hand if you want to, or say me or something like that, just so we can see through our audience how suicide does affect a lot of people. I mean, with it rising 30% in the past year or so, that's incredible to me. So, yeah. Anything else that you had with statistics?
Well, I just want to say how pleased I am that you're kind of opening this door. Because, so many people are afraid to talk about it. I think a lot of people are afraid to admit or verbalize that maybe they've even had thoughts about suicide. But, I just want to say that lots of people do. And by talking about it, it brings it out from the shadows and into the light. And, people can get help. Mm-hmm. So thank you for doing this.
Well, you're welcome. Thank you for coming on. I really do appreciate it. So we'll start off with some of my questions because I am Queen of Questions. You guys know I've got a whole lot of questions. And as we go through these, I'll probably have more questions. But I'd also like to open it up to those that are watching. If you have any questions that maybe we can talk about tonight, or a comment or whatever, I'd love to see what you guys have to say about this topic as well. So I think the first thing that comes to my mind is, I've had some low points in my life, but never have I ever considered taking my own life. So why do people resort to that? Like, why is it so prevalent and so like a popular, and it's rising? What do you think about that?
Well, when people are experiencing such deep and desperate emotional pain, it's a logical choice when you see no other way out of that emotional pain. So hopelessness, feeling trapped, not feeling connected, to other people. And so when you think about it in those terms, and when you have such deep emotional pain and it's unrelenting, it's just constant, no matter what you do. When you're down, you can go for a walk, you can call your friend, you can go shopping, you can do things that lift your mood and give you some temporary relief, or even just plain old relief from you feeling down. But when you're in such a state of despair, there's really nothing that you do, even, tucking your children in at night and doing things that would normally bring you joy. It's just not there.
So I guess, like, where does that come in when it's just being down and then you have reached that point where it's like you aren't getting out of it? Like, going outside to go for a walk is just not bringing you out of it.
Well, that's pretty much the line between just having a bad day and feeling down and clinical depression.
Okay.
So we know that suicide usually occurs more often in people who are experiencing clinical depression.
Okay.
About half the people who do see suicide as an option and who die because of suicide have a mental health disorder. But then that also says that about half of them do not.
Okay.
But it just means that we're not doing a very good job of helping people get to treatment. And because treatment many times is so difficult to access, that they just haven't been diagnosed.
Okay. All right. So, deep, clinically depressed.
Typically.
That seems to be the best way out of it.
Right. It seems very logical to
and
people when they're in a state like that.
And those people too, like, I guess I don't know if you know the statistics behind this, but how many of them have reached out to their friends or tried to get help, or do they just feel like they're a burden and they just want to be done?
I'm not aware of any statistics on that. However, feeling like you're a burden is a risk factor.
Okay. All right. So I think what I want to do now is just talk about some myths behind suicide, and let's bust some of those myths tonight. Thank you guys for joining us for this topic. I really do appreciate it. So what kind of myths are out there that you'd like to bust?
Well, here's my biggest pet peeve.
Okay.
Is if someone really wants to kill themselves, they'll find a way.
Okay.
So it doesn't matter, okay, so maybe you thwarted it this time, but if they really want to kill themselves, there's really nothing you can do. And that's just absolutely not true.
Okay.
Actually, Harvard School of Public Health noted that reducing a suicidal person's access to highly lethal means is an important part of suicide prevention.
Okay.
And so something as simple as using gun locks, gun safes, putting several steps between you and that lethal means can really make a big difference. And when you make a lethal mean inaccessible to a person who's experiencing suicide, it's a myth that they're just going to find another way. This actually is not supported in the evidence.
Okay. Because isn't that part of the whole process for somebody that is going to commit suicide when they're thinking about it, like exactly like how they're going to do it? And so I would think if firearm was the way, and now I don't have access, now I have to think about a different way. And so then that's bought your loved one some time.
Absolutely.
Okay.
Right.
So yeah. So that's a myth that we've busted tonight.
It is.
On ReLive.
It is.
Okay. Awesome. Well, thank you. What else do you have?
Well, I think another big one that I have is that we shouldn't talk about suicide because we don't want to suggest it to people. Or I don't want to put the idea in their head, so I shouldn't ask about it. Maybe I should try and get their mind off it. But again, that is not supported in the evidence, and it's just simply not true. By being comfortable asking about, have you thought about suicide? That's all you have to say. It opens that door, and you're telling that person it's okay to talk about it. I'm okay talking about it.
Okay.
Now, I just want to caution people that if you do that, then you have to listen.
Right.
So you can't just say, have you thought about suicide? And then be thinking, oh, please say no, please say no. And then they say yes, and then you go, so have you tried that new restaurant in town? You know,
Okay.
that is pretty much sending the message of, we're not talking about it. I'm not comfortable with this.
Right.
And, so please ask. If you have any
Mhm.
concerns about anyone's safety,
Mm-hmm.
just simply ask, straight up, forward, don't beat around the bush.
Okay.
And, if they say yes, say, I'm here for you.
Mm-hmm.
I'm here. I'm going to help you stay safe.
Mm-hmm.
And, you're not alone.
Mm-hmm. I'm really glad that you brought that up, because I think for me, thinking like, oh, I don't want to ask them that, because that would put it in their mind. But I'm glad that there's no evidence that supports that. And then also, I think, too, if you ask and they do say yes, that might just be what they were looking for.
Right.
Is someone to talk to them. Like, I've been sending signs and nobody's picking up on them, and they do just want someone to ask and show that you like care for them, and then be there for however long it takes to either help them or get them help.
Right.
So I think that's really important. So don't be afraid about putting something in their heads, guys. So we busted myth number 2 tonight.
I have one more.
You have one more. Okay, lay it on us.
So the myth that I would like to bust is there's really nothing you can do if someone makes up their mind to kill themselves.
Okay.
And that, again, is absolutely not true.
Mm-hmm.
Getting help from someone who's listening non-judgmentally, sometimes it's all it takes.
Mm-hmm.
Someone values me enough to
Mm-hmm.
hear me and acknowledge my pain.
Mm-hmm.
I mean, most of the time, and if you think your audience thinks about a time when you felt like really down or
Mm-hmm.
sad or whatever, I mean, when you reach out to talk to your friend or somebody, you're not really looking for advice.
Mm-hmm.
You really just want someone to kind of sit in your misery with you for a while.
Right.
You know what I mean? And this is kind of the same.
Okay.
So, being supportive, usually when someone has thoughts about suicide, sometimes it's just a matter of time.
Mm-hmm.
It passes, sometimes not. But I guess I just want to make sure everyone knows that just because someone says, I want to kill myself, it doesn't mean that they may change their mind.
Okay.
They probably will.
Okay. So you talked about the correlation between somebody with mental illness and suicide thoughts. So it's about 50-50.
Yeah. So the data out there is about half. Half the people who do end up killing themselves have been diagnosed with a mental health disorder, and about half have not.
Okay. So then would you say it would be more difficult for a friend to help somebody through those suicide thoughts that is diagnosed with a mental illness versus somebody that isn't? If it's just like Joe Schmo who, is healthy and doesn't have any record of a mental health illness, but he's just been having like a really bad month. Would that be easier for me to talk through and try to get off the ledge than somebody that does have mental illness? I guess if I'm trying to help somebody, do I need to be equipped with something more than just a listening ear if I know that they have?
Well, I suggest kind of a 3-step action plan.
Okay.
And it pretty much makes common sense. But the first thing is just to ask.
Mm-hmm.
And I said it before, I'll say it again. Don't beat around the bush, or, just straight up, as clear as day. Are you having thoughts of killing yourself? Have you thought about killing
Mm-hmm.
yourself? Or you can use the word suicide. So that's the first thing.
Okay.
Encourage them to focus on their reasons for living, not your reasons for living.
Okay.
So, and guilting them does not work. That
Mm-hmm.
actually will probably make things worse. So, think about what it would do to your children.
Oh, okay.
Or your children need you.
Mm-hmm.
They can't live without you.
Mm-hmm.
So that may not be their reasons for living, though.
Mm-hmm.
So we have to honor that.
Mm-hmm.
So ask and encourage them to talk about their reasons for living.
What if they don't have any? What if they're that deep in the pit and they're like, I have no reason to live?
I would say, I hear your pain. I hear what you're saying, and I'm here with you now.
Mm-hmm.
And allow them enough space and time that they need to talk.
Okay.
So just be present with them. Because I think our natural tendency is, oh, that's not true.
Right.
oh, well, look at this beautiful house,
Right.
man. You
Right.
know, you've got this great job and your
Mhm.
coworkers that you work with and a great husband and you have a son.
Right.
But really fight doing that.
Okay.
I think that's kind of a natural reaction.
Sure.
Instead, just sit with them and say, I hear you. That must be really painful. That must be a really difficult place to be. And let them talk.
Okay.
Just let them talk.
Okay.
The second thing that you'll need to do is to keep them safe.
Okay.
So you may need to ask, well, what have you thought about? So if you ask, have you thought about suicide, or are you thinking about suicide? And they say yes. I usually say, well, tell me what you've thought about. What have you thought about? So it can be as vague as, oh, well, I really haven't thought about anything specific. I just wish I'd go to sleep and never wake up. Or it could be something really specific.
Okay.
Like, I have taken these specific steps, and when I go home tonight, I'm going to do it.
Okay.
So in that case, you really should not let the person out of your sight. It'd be absolutely no different if you were having a heart attack and I said to you, oh, let's talk about it tomorrow at lunch. No, it's an emergency.
Okay.
You need to get help for that person immediately. There are local resources that we're going to talk about, I think, later in the show.
Yes.
But the second thing in this action plan is to keep the person safe.
So how do you go about keeping them safe?
You stay with them.
You stay with them.
You may need to call the police.
Call the police.
You may need to.
Okay.
And luckily in Lafayette, we do have police officers who are trained in crisis intervention techniques.
Okay.
So they do have some training on mental health disorders and how to talk to people and so on. So if you have, I always tell people it's better to err on the side of caution.
Okay.
Because your only regret will be not doing enough.
Absolutely. So what if they say, yes, I've thought about it and this is how I'm going to do it. And I say to them, okay, I really want to get you help and I want to keep you safe. Would you be willing to go here with me? Is there somewhere I could take them?
Yeah, to the local emergency department.
Okay, so they are equipped at the local ED to take care of them.
They all have social workers on call, or
Okay.
therapists, or psychologists, mental health professionals who can do a more thorough evaluation, and they will assess your safety and then what needs to happen.
Okay.
In order to keep you safe.
Okay, so step 1, don't beat around the bush. Ask. Just ask. Step 2, you've got to keep them safe. In step 1, there's follow-up questions. If they say yes to, what have you been thinking about?
Yeah,
okay.
Tell me about what you've been thinking about.
Okay. And then step 2 is keep them safe. And then step 3.
Just let them know that you're there for them. And so that may mean following up with them. I've had people tell me that, they had, maybe they attempted suicide or they had thoughts of suicide and they were hospitalized psychiatrically. And now if they were hospitalized because their appendix burst, they'd have a room full of flowers and cards and people would be calling and visiting and so on. But because they have a psychiatric emergency and they get hospitalized for their psychiatric condition, they get nothing. Okay. So reach out and let that person know that, you're there for them, you care about them, and not to be afraid to reach out.
I think that all falls back to that it's so taboo and hush hush, like we don't want to talk about it. So why am I going to go to the hospital and check up on them, or, like that's their issue. And
yeah, but if they were laying in a hospital bed, you'd be bringing them ice cream and, magazines to read. So you can do the same for a psychiatric unit.
Probably at this point more than any, they need a friend. They need to know that someone's around and willing to talk to them and spend some time with them. Okay. Those are really great action steps. So thanks for sharing those. And we can probably type those up and put them in the comments later tonight when we're done so that you guys have those tangible to look at. All right. So we talked about the correlation between mental health and suicide. And we talked about some action steps. Let's talk now about what to look for in our loved ones and what are some signs. And yeah, let's start there.
Well, I mean, it's going to seem pretty typical, but if anyone's talking about it. And like I said, there's a high correlation between feelings of hopelessness, emptiness, feeling trapped,
Mm-hmm.
and suicide.
Okay.
So if your loved one or someone you know is using that language, I
Okay.
have no other choice. I don't know what to do. Or wouldn't it be better if I weren't here?
Mm-hmm.
Things like
Mm-hmm.
that. Back in my day, they'd said, oh, if the person writes a suicide letter, gives away their possessions, those are signs. Well, that can be that, but really any change in behavior
Mm-hmm.
should kind of clue you in that something may be wrong. So if normally this is an outgoing, loving person, and now they're isolating and they're
Mm-hmm.
irritable and angry, or if they're saying they're having nightmares or they're not sleeping
Mm-hmm.
or they're not eating, you notice, weight loss or weight gain for that matter.
Mm-hmm.
If they're talking about not feeling worthy, having guilt or shame
Okay.
about anything, if they're starting to use alcohol or drugs, and that's out of character for them.
Okay.
A lot of people may turn to alcohol or drugs
Mm-hmm.
because they're desperate to feel better.
Sure.
They'll do anything.
Okay.
Taking risks, such as reckless driving, things that may put them in danger or that may result in the death.
Okay.
And I guess that's it.
Okay.
I mean, anything that seems to be any kind of that they're in the planning stage.
Change of behavior.
Yeah, change of behavior, talking about it,
Mm-hmm.
and especially talking about feeling trapped, worthless, hopeless.
Okay. So trapped, worthless, hopeless, not really, probably withdrawing from people too, right?
Right.
What about probably work attendance?
Well, that's always goes back to level of functioning. Yeah.
Okay.
So any change in their activities of daily living.
Okay.
So if they're not going to work or they're not showering like normal.
Okay.
Just any change, like even like keeping up with their housework, things like that.
Okay. All right.
Especially when there are things that, the thing about depression is that things that you normally got pleasure from, you don't anymore.
Okay.
And I think that's like one of the most disturbing thing for people. It's not about, I feel sad.
Mm-hmm.
Or I'm crying all the time. It's really this deep, deep pit of emptiness.
Mm-hmm.
So things like gardening, or I used to love hiking, and I love nature, and that brought me peace, and that was my place. It doesn't do it for you anymore.
Mm-hmm.
And that's a horrible,
So what brings that on? Is it like just automatically a switch, like an imbalance in your brain, or is like could a event happen?
Well, typically it's a combination of things.
Mm-hmm.
So for some people, it's just the neurochemical imbalance, basically at the major serotonin, norepinephrine, and dopamine. For some people, it's that in addition to some maybe childhood trauma or issues that they've had. Could be you layer all these things on losses. You've lost a loved one due to death, or you lost your job that you loved, or something like that. Depression is a really strange thing because, and that's really for mental disorders in general, because sometimes they're like smoke coming in from underneath, your door just slowly creeps in over time until it fills the room. And sometimes it can just bang you over the head with a sledgehammer.
Really?
Yeah.
Wow. Wow. That's crazy. All right. So what about social media? I would imagine with the rampant, fast social media everywhere, I imagine that plays a part in everything. And then what do you do if you see?
Well, especially in the younger kids, and not so much for Indiana, but for other states, between the ages of 15 and 24 is a really high risk period for suicide. Indiana, it's a little bit later, and I'm not really sure why that is. And we know, well, for our young people in that age group, they live and die by their electronics and social media. So much so that I don't even understand it. I can't even begin to understand it.
Right.
But so that may be where they turn. So, we need to be educated about, well, what do we do then if someone starts talking about these things that we discussed, but on social media?
Mm-hmm.
Now, so I did a little research on it, and pretty much every social media platform has a web page and they do monitoring. So Facebook, Instagram, Snapchat, Tumblr, and Twitter, and even YouTube. They all have some safety policies in play. So if it's something that's doesn't indicate that it's an emergency or that you have an immediate concern, you can turn to look online to see what their policy is, and then they will intervene in some way. Now, if it's more happening in the moment, or if it's a live stream, then you should probably call 911.
Okay.
And have the police come out and do a wellness check.
Okay. So that is another option too for your loved one. You can always call the police if you're concerned about a loved one. Maybe you haven't seen them or heard from them for a couple of days. You can send the police out there.
Right. And then it's called a wellness check. They can go out and just do a wellness check. And
so would it be beneficial to tell them kind of what's going on so they know to send like one of the suicide crisis? Right. Crisis intervention officer. Okay. Yeah. And do they always have one of those on staff?
They do.
Okay. That's good to know. Very, very good to know. Awesome. All right. So we talked about what to do with your loved ones, but then like what are some local options available for them if you want to refer them somewhere, take them somewhere, or give them a phone number or something?
Right. Well, if you feel like the person that you're with needs to be immediately evaluated, you take them to the local emergency room.
Okay.
But there are, like Mental Health America has a really good crisis line, and it's local.
Okay.
It's local. And you can call them or you can text them.
Oh, that's a great feature.
So I have the phone number here if you want me to read it.
Sure, if you want to read it, and then we'll put it in the comments later tonight.
Okay. So it's 765-742-0244. And then there is a national suicide prevention hotline that's staffed 24/7 with mental health professionals, and that's a 1-800 number.
Okay.
273-TALK. 8255. Now, locally, Sycamore Springs has a 24/7 line as well.
Okay.
So, and if a person needs to be evaluated immediately and you want to take them directly to psychiatric, professionals, then you can call them and take them to Sycamore Springs, which is a local psychiatric hospital for evaluation.
And you can take them there 24/7.
Correct.
So at what point would I differentiate between taking them to Sycamore Springs or taking them to the emergency department?
Probably, I would probably work in with the person.
Okay.
I would ask them what they would prefer.
Okay.
Maybe if they've been to Sycamore Springs before, or they're already getting therapy, through Sycamore Springs outpatient. That may be it. If they don't want to have to sit in the emergency room for a few hours, because you know how that can be, depending on how busy they are, then maybe they just want to go ahead and go straight to Sycamore Springs. Call them first.
Call Sycamore Springs first, okay, to see if they have a wait or...
See if they have beds available.
Okay.
Yeah.
Okay. All right. What about family history? What if, I had a parent that committed suicide or attempted? Am I more prone?
Actually, that is a risk factor.
Okay.
Risk factors can be if the person has ever tried to, suicide before. If they have depression, a substance abuse disorder, and a family history of mental health or substance abuse disorders, or if there's a family history of suicide.
Okay.
That is a risk factor. Having a gun is actually a risk factor. Guns are used very frequently in suicide. Actually, here in Indiana, they're used about half of the time.
Oh, wow.
Yeah. Actually, even being exposed to other people's suicidal behavior, such as a family member, media figures. There have been media figures lately who have completed a suicide. So if you get really kind of, obsessed with or overwhelmed with that, especially if you are a big fan of theirs, that can be a risk factor. Having a medical illness, especially a chronic pain condition. And again, being between that critical age of between 15 and 24, and also over the age of 60.
Oh, really?
Mhm.
Over the age of 60?
Yeah.
Like in that retirement, life change.
Right. Well, typically in that age group, there's more medical issues going on and more losses.
Okay. Interesting.
Yeah.
All right. Very good. I'm going to scroll through here and see. This is where it gets awkward because I'm right up here in your guys' face. Okay. It doesn't look like we have any questions yet. Okay. Feel free to send those questions in, guys, if you have any questions. I'm going to look at my list here and see what we haven't talked about yet. So we talked about where they can go locally for help, and we'll put that information in later. And then what if you have a person who you've talked to, they have a mental illness, and they could be helped with taking medicine. And they say, you know, I'm not going to take it because I don't want to take medicine. I don't want to take a pill every day.
There's a lot of myths about that too. Like you'll get addicted, or you'll get like reliant on it. And a lot of people are told, you know, don't take that antidepressant. You'll just get dependent on it. Like you won't be able to be happy without it, kind of a thing, which isn't true. Or we would never say that to someone who has diabetes.
Right.
You know, don't take that insulin. Right. Because you might get dependent on it. But it's exactly the same thing.
Okay.
It is a neurological disorder. It can be seen now on scans, like PET scans and CT scans.
Really?
Yeah, they can actually see, you know, areas of the brain that, you know, are not functioning correctly. We know because medicines work.
Okay.
That it is a real disorder, a brain-based disorder. And I don't want people to think that your only option is to take medicine, because therapy works just as well. Psychotherapy works just as well as medication.
Okay.
And for people who have depression or anxiety disorders and many other mental health disorders, the combination of the two is actually the best treatment option.
Oh, really? Okay. So is that just seeing a therapist like once a week, or?
Yeah, you and your therapist will decide what works best for you. Sometimes group therapy may be recommended.
Okay.
Yeah, it really depends on kind of the severity of your disorder and how much of an impairment it is for you.
Okay. Okay. Let's talk a little bit about how Purdue just added the psych mental health nurse practitioner program, because it was needed in the area. Didn't somebody come to Purdue and ask for it?
Yes. Actually, what happened is, for a long time, it didn't matter if you had insurance, how good of insurance you had, or even how much money you had. You could be willing to pay out of pocket for a psychiatric evaluation. It didn't matter because there's nowhere to go. Everybody was backed up so much that maybe if you were willing to drive to Indianapolis, you could be seen in a month or so.
Oh, wow.
And for people, many times, like I said, it can hit you over the head like a sledgehammer. Or if it's like smoke coming from underneath your door and boom, your room is filled with smoke and you are in a state of despair and you want to get help as quickly as possible, you don't want to wait.
Right.
And many times, not always, but psychiatric disorders can be progressive in nature. So the longer you wait to get treatment, the more difficult it is to get you in remission. So North Central Health Services actually came to Purdue School of Nursing because it seemed only natural that Purdue School of Nursing, who has a really long reputation for putting nurse practitioners, really qualified nurse practitioners out there, would consider starting a Psych NP program. And because of them, they provided the funding that allowed us to start this program.
Awesome.
Right. And we graduated our first cohort of students this past May, and they're out there working right now. And it's really grown.
So let's talk a little bit about, because I was just having a conversation with a friend not too long ago about Psych NPs. What does a Psych NP do?
Well, pretty much Indiana is a collaborative state, so we work in collaboration with a psychiatrist or a physician.
Okay.
Which means that they will review 5% of our charts at least, and they're on call for us. And usually there's some supervision that occurs. So you go to them and you talk to them about individuals that, or not responding to treatment like you would expect, and you just work in a collaborative arrangement. But a psychiatric mental health nurse practitioner does a psychiatric evaluation just as a psychiatrist would do, spending a minimum of 1 hour with you. And then they collaborate actually with other treatment team members, or they might get collateral information from your primary care provider or other individuals, as long as they have a release of information, your permission to do so. And then they develop a treatment plan with you. So you're in control of it.
Okay.
And it's centered on what you want and, you know, what works best for you.
Okay.
That's the important thing. And as a consumer, that is what you should expect, and that's what you should get. So no longer should you go to a professional of any kind and they tell you what to do.
Okay.
We know that doesn't work.
Okay. So then also, I believe the benefit to seeing a psych NP is they also can control your medication.
Right. So we are qualified. We do have an Indiana license to prescribe medication and Indiana and national DEA number. So we can start medications, stop medications, order labs, any other tests that are necessary, and manage your medication. And then I tell my students, you know, they do take a course on psychotherapy that's co-taught with Laura Hawkins, who's a licensed counselor. So they are able to integrate some forms of psychotherapy in their appointments. And if they want to do more specialized psychotherapy, then they are positioned to go get additional training.
Okay. Okay. So if a loved one wanted to start seeing a psychiatric nurse practitioner, how would they go about finding one in the area? Are there many in the area
Not
right now?
right now, only because we're such a new program, we've not been able to provide, you know, the area, you know, with them. But
we'll graduate some next
we'll
May.
be graduating some in May, and some, about 4 or 5 of them live in this area, so they'll be looking for work in this area. So I'm hoping beyond hope that this will improve. And you know, one thing that bothers me is that because there's been such a lack of psychiatric mental health providers, that we feel then that it's okay to like lower the bar of quality, and that I think is just not acceptable. You know, that's why the program, I feel like, is going to really produce qualified and competent practitioners.
Right.
And so don't accept, you know, if you're not getting better, then go to somebody else. Find somebody else. If it's not working for you, I just want to tell people you're important, and your health and mental health is important.
Absolutely. Absolutely. So until the Purdue School of Nursing provides qualified nurse practitioners for the psychiatric level, what would be the best route to see just a counselor in relation with their general practice?
Well, unfortunately, if you want to get started on medication, you may need to turn to your primary care provider. And it will depend on your primary care provider whether or not that they're comfortable doing that.
Okay.
You know, it's a sad state that the majority of mental health treatment is provided in the primary care arena, but it is. And if you want to see a therapist, if you have insurance, that will probably guide you where to go.
Sure.
Yeah, and if you don't have insurance, then your options would be, you know, pay out of pocket or Valley Oaks, which is our local community mental health center.
Okay, so Valley Oaks is a good option for those that don't have insurance. Okay, good to know. All right, that was a lot of off script, guys, but I do that. All right, so let's move into, we've talked a lot about suicide prevention and awareness tonight, but let's just kind of move into what can somebody do just to increase their general state of mental health?
Well, it's different for everybody, honestly. And so I can't say do 1, 2, 3, 4, 5,
Sure,
because it's different for everybody. But generally, having healthy relationships in your life. And we know that when you feel connected with people and you're in relationships that make you feel worthy and, you know, feed your soul kind of a thing, that is a common condition, you know, for people who maintain good mental wellness. You know, getting decent sleep, keeping a decent, you know, I know it's probably what everybody says to you, diet and getting some form of activity every day. But actually, there's tons and tons of literature out there about getting daily activity actually produces more dopamine.
Sure.
Dopamine is kind of that neurotransmitter that makes you feel pleasure.
Okay.
Yeah. And I think we call it agency, but really working on knowing that you are in control of your life. And that it's okay to not be okay. It's it's okay to ask for help, and to get it. I just can't say that enough.
Right, and to consistently, like, probably, like, don't just go once and expect to be better. Like, it's gonna take some time. Probably the smoke came in through the door.
It didn't. Yeah.
Didn't just happen.
It takes a while to clear it out.
And I think too, it's important to establish that relationship with a therapist or a psych NP that you trust and you feel like you can go in and talk to in your deepest, darkest moments and find somebody. And there are a lot of different options out there, even with your general primary care doctor. Like, if you aren't happy with the way things are going, like, you're in control of that.
Right.
So find someone else that's going to help you, I think is important to know, to do.
Yes.
Like, it's your body, people.
It's your life.
It's your life. It's your body. It's
and
your
you're
mind.
worth it.
Absolutely.
You're
Absolutely. Yeah. Okay. So I think we've covered most of my questions here as I go through. Is what do you want to leave the audience with? What last thoughts do you want to leave them with? Or was there something in your notes that maybe we didn't cover? I think we've had a great discussion tonight.
It's a public health issue and it's preventable. It's probably one of the most preventable public health issues out there. Don't be afraid of it.
Okay.
It's not contagious. Just asking isn't going to make anybody go do something they weren't already going to do. I've read lots of stories of people who were on their way to the bridge, to jump off it. And that one person just smiled at them and it made them turn around and walk the other way. So you may think that what you're doing is very little, but it's not. It's a lot. Just being there and being present with someone is many times kind of just all they need.
Right. Be kind. The world needs more kindness, right? Okay. I don't see any questions. This has been fantastic. I really appreciate you coming on tonight and talking with us. So thank you so much for spending your Tuesday night with us. I do want to talk about next week, guys. Next week, a week from today, is my anniversary, my wedding anniversary. My husband and I are going to celebrate 14 years of marriage on the 10th. So thank you. Thank you. It's 14 years. I can't believe it. Well, I can, because it feels like a long time, and he would say that too. Anyway, I am going to be live next Tuesday night. My husband is so supportive, and he's like, yeah, do it. Probably because we're celebrating over the weekend, going out of town. Anyway, so I'll be live next week. I've got some couples that have agreed to come on, and we're going to play a game next week. So I'm super excited about that. So make sure you tune in. If you're watching tonight or if you're watching tomorrow or the next day, please #replay so I know that you've watched. I really appreciate that. And thank you guys so much for joining us for somewhat of a more real topic that I'm not the best at, but we got through it, guys. So thank you so much. Have a great night.
Thank you. Good night.
Awkward. Can't find my... There we go. Bye.